Do avoidants feel guilt? Understanding emotional complexity in avoidant attachment styles. One question that often rises is whether avoidants feel guilt, particularly in the context of their interpersonal relationships. The answer is yes, avoidants do feel guilt, but their experience and expression of it are influenced by their unique emotional patterns and coping mechanisms. Guilt in avoidant individuals. What research says while avoidants may appear emotionally distant, studies suggest they are not immune to feelings of guilt. According to research published in the Journal of Personality and Social Psychology Fraley and Shaver, 2000, avoidants often experience guilt when their actions or lack thereof conflict with their internal values or cause harm to others. However, they may struggle to process or express this guilt openly due to their discomfort with emotional vulnerability. How guilt manifests in avoidance. 1. Internal conflict. Avoidants may experience guilt as an internal conflict between their desire for independence and their care for others. For example, if they withdraw from a loved one to maintain emotional distance, they might feel guilty for hurting that person, even if they don't express it outwardly. 2. Subtle signs of remorse. Avoidants are less likely to verbally apologize or openly admit guilt. Instead, they may show their remorse through indirect actions, such as attempting to make up for their behavior by doing something kind or thoughtful. 3. Defensiveness as a coping mechanism. To avoid confronting feelings of guilt, avoidants might become defensive or dismissive. This reaction is often a protective mechanism to shield themselves from emotional discomfort. Expert opinions on avoidant guilt. Dr. Sue Johnson, a clinical psychologist and the founder of Emotionally Focused Therapy, emphasizes that avoidants are not devoid of emotions but have learned to suppress them as a coping strategy. Guilt, according to Dr. Johnson, can be particularly challenging for avoidants because it requires acknowledging emotional impact, a process they are often unaccustomed to. Dr. Amir Levine, a psychiatrist and author of Attached, A New Science of Adult Attachment, adds that avoidants may experience guilt more acutely in long-term relationships where they genuinely care for their partner but struggle to meet emotional needs. This guilt, though unspoken, can weigh heavily. Here are some evidence-based strategies. 1. Practice emotional honesty. This may involve journaling, therapy, or talking with a trusted friend or partner. 2. Acknowledge the impact of actions. Developing empathy and recognizing how their behavior affects others can help avoidants address guilt and foster stronger relationships. 3. Seek professional help. Therapy, particularly attachment-based approaches like EFT or cognitive behavioral therapy (CBT), can help avoidants process their guilt and explore underlying attachment issues.